Good afternoon to everyone. This is Dana Matz from your Chamber of Commerce. Thank you for joining us today. We hope that you will find the information that is shared today of value and as an operational resource for your business. We ask that you consider today's presenters from the Genesis HealthCare System and the Zanesville-Mesquite County Health Department as partners for your business, and as your partners that you will reach out to them as they are sharing their resources for your business. Joining us today is Matt Perry, the CEO of the Genesis HealthCare System, our local hospital. Matt and I have had numerous discussions since the COVID-19 pandemic started, and each time we speak, Matt has asked, how can the hospital system help our business community above and beyond providing medical services? And out of those conversations came the idea for today's meeting. So let me say thank you to the Genesis HealthCare System team for facilitating this teleconference, and at this time, I'll turn the meeting over to Matt Perry.
Thank you so much, Dana. Thank you, everybody, for joining us, and I want to appreciate Dana for helping us to get this organized. Also would like to thank Corey Hamilton and Dr. Butterfield from our health department for being here to share their thoughts with you. They have some very important information to share with you after we kind of talk about our program a little bit. And as Dana described, this is something that has really come out of our desire to figure out how can we help our community employers through this COVID-19 situation. And I want to describe that over the past 2 months, Genesis has been, we have been learning about this. We have been taking care of patients through this entire process, both COVID patients, the few that we've had in our area, as well as all the other types of patients. So we have been figuring out how do we do our business and do it in a very safe way. And so that's something that we feel that we have been able to accomplish. And it is very safe for people to come to Genesis for their care, whether it's for concerns over COVID or anything else, by the way, whether it's to the hospital or whether it's to the physician office. We do not want people to be afraid to seek our services. And so we feel like we have accomplished that level of safety. So, and in that process, we've also had to manage our staff. So we have staff that show symptoms of all sorts of things. And so we've had to develop and implement policies for making sure that we assess and put staff off from work, and then when appropriate, then bring them back in a very safe way so they can make sure that they are safe, that they can continue to help us to operate our business in a way that is safe for our customers. So as we were thinking about this, we looked at it and we realized, well, we know every employer in our community is having the same questions about how do you operate and be able to serve your customers and do it in a way that keeps your customers safe and also enables you to keep your staff safe. And to manage through if your staff have symptoms that you don't know how to deal with. So out of that came this program. So we have been operating this program now for about 7 weeks. And so we felt like we had some very specific policies, procedures, and processes to share with you. So that you can operate your business and manage your staff in a way that helps you run your business and continues to gives you a set of tools to manage your staff. And we are going to do this free of charge. And so I would like to, to us, it is a way for Genesis to give back to our community. We are all in this together. And our community is pulled together in so many ways to help us do what we've been doing over the past 2 months. And this is one way that we want to be able to show our appreciation back to our community and to our employers. And we highly value your partnership. So I'm going to turn this over to Josh Jones. Josh is the practice administrator of our occupational and employee health program at Genesis. Has been working very closely in a tremendous partnership with our health department. Corey Hamilton and Dr. Butterfield, we have been together very, very closely throughout this whole process. So what we're going to describe is a process that is very integrated with the health department and what they do. And so Josh has put this together, and Josh, take it away.
Okay. Thank you, Matt. I appreciate that. Good afternoon, everyone. Again, my name is Josh Jones, and we are very excited, extremely excited and fortunate to be able to offer this free program for you all and propose this partnership to you. If you're on Teams, you'll see the PowerPoint slideshow. That was sent out via email. If not, we can make sure that you have access to this after the meeting. You can contact me if you do not have it. So the very first slide, I want to read just a headline that says Southeast Ohio Daily News, breaking news, local business shuts down due to COVID outbreak among employees. So I think we can all agree that even though this is a fake headline, this could be reality, and that's what we are trying to avoid in our community. I think we can all agree that we don't want this for any business in our area, and I think that we, working in partnership along with this proposed plan that we have that we are going to be going over with you today, will support our efforts in making sure that this does not happen in our community. So as we start to look at reopening, some of you may have already been open and looking at how can we better our business in dealing with this COVID pandemic. Some of you may be looking at reopening and wondering what steps do I need to take in order to reopen, and how can I keep my employees safe, or what do I do if they show up for work or they're working and they start to express symptoms. So some of the questions that you might be asking yourself, whether you're open or planning to open, is what resources do I have to control this work environment with the presence of COVID-19? And what do I do if I have an employee that presents with COVID-19? What is my direction to them? And who can I turn to as a resource to answer questions in direct care? And the last thing you might be asking yourself is, how do I reduce my employee concerns about COVID-19 in the workplace? So folks, this is the reason that we are here. This is the reason that Genesis is here, to partner with you as our area employers, to be that resource, to be that partner, to be that resource to direct your employees' care, to answer your questions, and as it pertains to COVID-19 operations. And the last thing is, we want to be able to ease your employees' concerns and anxieties about returning back to the workplace or remaining at work. The next slide. So let's talk about our purpose, our goal, our intent. So as you heard earlier, Matt and Diana, through conversation, has had this great and generous idea about how can we help and assist our area employers. How can we assist them with the operations with this COVID-19 pandemic? So our purpose here is to be a valued resource for you all in creating this partnership with the health department and area employers to provide a free service. I know that we indicated that earlier, but this is truly a free service that we want to offer our area employees and employers and to support the navigation through this COVID-19 time. So the things that this program will include, and I'll go through these in detail later on in the presentation, is we are looking at a free screening and visits for symptomatic employees, and we'll go over these again a little later. So we are also looking at free tracking services for COVID-19 and exposed employees. We are also looking at free return to work assessments for your employees, for our partnered employers in this program. So we feel that this partnership with our employers, if you join this program, will strengthen our efforts to care for our symptomatic employees and reduce workplace exposures and establish a safe return to work environment for your workforce. So when this first started, when the whole COVID pandemic started, we were concerned, I think everybody in the area was concerned about the stay-at-home order, the closures, and the potential surge that we were expecting. And I think that we can all agree that our current state here in Muskingum County, I believe that our residents here in Muskingum County have listened to those orders. We have done what we were supposed to do along with the state of Ohio, and I think that has strategically placed us in a position to where we can start looking at the reopening of our economy and reopening of our healthcare, and start to get back to business as normally as we can with COVID being present. So establishing such guidelines and these partnerships that we are proposing will aid in the reduction and tracking of potential workplace COVID-19 exposures. So let me talk a little bit about what we have been doing here at Genesis that we would like to share with you as a partnered employer. So we have, for 7 weeks now, have been managing and monitoring over 3,000 employees here at Genesis. And we have implemented protocols and procedures throughout that 7 weeks that by all means have changed. Some change daily, some change weekly, but we have managed to keep up with the changes and keep our patients and our employees safe. And I think that's the very important piece here. I think the important piece is our workforce is a very important piece of our business. Without our workforce, I don't think our business could run. And here at Genesis, you know, our business is taking care of patients. So we want to make sure that everybody that is coming into our hospital is safe. So what have we been doing?
Josh, advance your slide.
Oh, sorry. Yep. And there we go.
And one more.
One more. Yep, there we go. Sorry, folks. So what have we been doing? What has Genesis been doing? So we have been doing employee health assessments and screenings prior to the employee shift. We ask people to, when they wake up in the morning before they come to work, they need to check their symptoms. They need to, you know, make sure that they don't have any new onset of symptoms that are COVID-like symptoms, and we will go over that here in a few minutes. We have also provided a clear path to care for COVID-19 symptoms through our telemedicine COVID line clinic and also through our occupational employee health line. We've also tracked or developed a tracking system for our positive and symptomatic employees, so we can report out to our management who and how many employees are currently experiencing symptoms of COVID-19 and when are those folks able to come back to work. And then finally, we have provided a quick and easy return to work assessment for our employees. So we really want to make this as easy and painless as possible for our employees, and this is the same thing that we want to provide to you all. But again, even though some of you may not be in the healthcare business, I believe that the majority of these practices, if they are applied to your business, will provide your workforce the peace of mind that they are coming back to a safe work environment. And again, this stresses that their health is your top priority. So coming down from the Ohio Department of Health, I'll go through these quickly, but guiding principles. There are 3 guiding principles that were handed down from the, actually this is from the coronavirus.ohio.gov website. So getting back to work, the 3 guiding principles are protect the health of employees, customers, and their families. I think that is very important. I think that we all agree with these 3 principles. Support community efforts to control the spread of the virus, and I think that's where our program falls into as well. And third is lead in responsibly getting Ohio back to work, and that is what we are wanting for our area and for our area employees and employers. There have also been 5 protocols for all businesses that were handed down as well. I'll go through these and I'll just touch base on a few of them here. But the first one is no mask, no work, no service, no expectations, or no exceptions. So we here at Genesis, we all wear our mask throughout this organization. So that is one thing that we are adhering to. We have been adhering to, especially when in the patient care areas. The second point is conduct daily health assessments. Again, this is the important piece. If I wake up in the morning and I'm not feeling my normal self, I think I have to, you know, do a self-assessment and say, am I sick? The directions out there, you know, from the health professionals are, if you're sick, stay at home. You know, we'll go through the symptoms on the next slide. But the important piece here is checking employees' temperatures before they walk into your workplace. That is a recommendation. We are doing that for our own individuals, our own employees, and if the temperature is above that threshold, they are not permitted in, and we send them to be assessed by a health professional. That is just a protection point that helps us manage the COVID-19 pandemic in our own organization. Again, that protects our employee workforce. The third one is maintain good hygiene. I think it's pretty self-explanatory. I think it's more often that we need to do that. Clean and sanitize, and limit capacity to meet social distancing guidelines. I want to jump back to number 2 just briefly, because I know that in the beginning of this COVID pandemic that there was a run on thermometers as well as some other household items, as we have all heard. But there has been difficulty with obtaining thermometers for employers, for the community. But I do want to let you know that Northside Pharmacy, we do have a number of thermometers available for this program for our employers. That is, the cost is $19.99. So that's one thing that I do want to stress, is that if you need more thermometers or you need thermometers in general, please let us know, let me know. I'll give you the contact information later on in this presentation, and we'll make sure that you have the resources that you need to check your employees' temperatures.
That's the only part of this that has a charge to it. We're basically passing the thermometers along at cost to you. And we wanted to try to find one that was reliable, that we could recommend, and that we could acquire large numbers of.
Thank you, Matt. That is absolutely correct. So the next slide that I want to go through is, let's talk about what COVID-like symptoms are. How can we potentially identify our employees that have COVID-like symptoms in our workforce? So this is from the Ohio Department of Health, and it indicates that you may have COVID symptoms if you have one or both of these symptoms. First one's cough, the next one is shortness of breath, difficulty breathing. The next piece of this is have at least two of these symptoms: fever, chills, repeated shaking with chills, muscle pain, headache, and sore throat. So again, we all know our own bodies, we know our seasonal allergies, we know how we feel. So I think it's very important to stress that, you know, these things that are listed here, is it baseline? You know, is it worse than baseline? Are they new symptoms? I think this is very important for us to understand. And if there's any question at all, again, this is where we come into play. This is where that free health assessment is available. So let's talk about our program and our operations that we want to partner with you. So looking at, I'm on slide 9 for those of you who are following along.
Skip the slide.
I skipped the slide.
Pretty good.
Oh. Yep.
You did repeat that.
Yep. So with our partners, we should do the following in this program. So if you sign up and we develop this partnership, what do you do if an employee presents to work or calls off for COVID-19 symptoms? So the first one is send the employee home immediately and instruct them to contact Genesis Occupational Employee Health. The second piece of this is we would ask the employer leadership that we will define through our service agreement who that contact person is. We were asking them to contact us to communicate the event of the employee being sent home due to the illness and provide a valid phone number for the employee so that the appropriate screening can be accomplished. So what this means is once you send that employee home, please give us a call. If you've signed up for this program, we will reach out to the employee. The employee is given instructions also by the leadership, the employer leadership, to call us. So we are trying to bridge any gaps that, so we can capture that patient or your employee so there isn't a gap, and so we can care for them appropriately. And it's very important that we have the name and a working phone number. So the third point, or the third point, is Genesis Occupational Employee Health will schedule a telephone screening assessment appointment to determine the direction of care. So that first point of contact would be from a registered nurse. She will talk to your employee, she will gather symptoms, and she will create a telephone encounter. From that point forward, she will send this employee over to our COVID line tracking telemedicine clinic, which there the patient or employee will be evaluated by a physician or a nurse practitioner. From that point forward, they will direct care to that patient. So what are the next steps? So let's talk about the visit shortly, briefly. What does that consist of? So again, this service is free. If your employee goes through this program, calls Occupational Employee Health and is sent to this telemedicine clinic, then this will be This will be the free clinic visit. So some of the questions that might be asked, but again, it's not limited to this, is do you have a fever 100.4 or greater? Is your cough worsening from baseline or a new cough? Shortness of breath worsening from baseline or new? Do you have a sore throat? Do you have a history of allergies? One thing that I want to put a disclaimer out there is please note that there will be a detailed review of symptoms. This is just a brief list of what could be asked. We are leaving it up to our health professionals, our doctors, our nurse practitioners to make their own medical judgment and medical assessment. But there will be a detailed review of symptoms along with a detailed intake of history in order to direct further care. So when do we test for COVID-19? So this is one of those changing things, you know, from 7 weeks ago from when we've started to currently, how we prioritize our employees, in this case patients, and when do we test for the COVID-19. So there are 3 priorities. Priority 1 is hospitalized patients, and the second one is healthcare workers. Priority 2 is individuals with symptoms who are in long-term care, congregate living facilities, first responders, critical infrastructure workers, age 65 or older, and living with underlying conditions. So some of you out there, you may have employees that develop symptoms that are in this priority 2 level. You may have a workforce that you have 65 or older individuals in your workforce. You probably have individuals that are living with underlying conditions, and along with these symptoms would spark the provider to order that COVID test. Priority 2A is individuals and staff without symptoms who are in long-term care congregate living facilities with an outbreak. And priority 3 could be the majority of our other employees, which is other individuals with symptoms and individuals with mild symptoms in areas with high COVID-19 hospitalizations. And again, in that priority 3, it's the clinician or the doctor and the nurse practitioner that uses their medical judgment to determine testing at that point. So the easy button here is what if an employee tests negative for COVID? We've sent the patient on for COVID testing. The COVID test comes back and it is negative. So this is I would think that it's a simple process, but if results are negative, the employee will be notified and sent back to work. Occupational Employee Health will contact the employer with a return to work date. And if symptoms persist, the employee will be directed to follow up with their primary care provider. And of note here is if they do not have a primary care provider, we will be giving them the information to our Genesis 1 call number to establish a primary care provider in order for them to seek further care. But the important piece here is we know that they're negative for COVID. And that brings us to the big question. So what do I do if I have an employee that tests positive for COVID-19? In our program, we are asking that what we will do is Occupational Employee Health will report a positive result to the local health department. They will probably more than likely already have those results, but we want to make sure, again, that we are bridging those gaps and making sure that they are aware, alongside with us, that we have a patient that is positive. The local health department will reach out to the employee and provide further instruction and direction on their care for that positive result. Third, the employer will work with the local health department to identify potentially exposed individuals to help facilitate appropriate communication and contact tracing. This is where our other free service will fall, and I'll get into that here in a moment. But we will work with you all and with our health department, and we have developed a tracking spreadsheet to track those employees who have tested positive and who have been exposed to a known positive patient. So let's go through the next slide here briefly, and this is purely an example of just a step-by-step what to expect if you're in this program and you sign up for us or sign up with us. Is an employee is experiencing symptoms mimicking seasonal allergies, but presents to the workplace with symptoms of fever, sore throat, runny nose, cough, and congestion. So the employee is then sent home by the employer and instructed to call Occupational Employee Health. The employer leadership, which we identified earlier through our service agreement, contacts Occupational Employee Health to communicate sending an employee home due to COVID-like symptoms and provides a valid phone number for the employee. The employee is telephoned and screened by Occupational Employee Health registered nurse and is determined that the symptoms are worse than their typical allergy baseline, and then they're directed to the COVID telemedicine line clinic, where they will be evaluated by a physician and nurse practitioner. A provider performs a complete assessment and determines this patient is a candidate for COVID-19 testing. The testing is completed and sent for analysis. Patient is sent home and instructed to self-isolate until the results are reported to them. So they will be handed instructions from this that we get from the CDC, and there's a packet that we have that the health department has provided us that we hand all patients that are being tested for COVID-19 to take home with instructions on what to do until they get those results. The the patient test results return with a positive COVID-19 diagnosis, we make sure and notify the health department of the positive case. The health department notifies patients of results and provides instructions on a 14-day quarantine. And following the 14-day quarantine, if the patient, an employee, is fever-free for 72 hours and improvement in respiratory symptoms, the patient will call occupational health for a free return to work assessment. That's the third free service that we are offering, which is the return to work assessment for the employees in this program. The patient is then released to return to work. Occupational health will contact the employer to communicate the return to work date. So let's look at the exposure process in motion. So this is if you have a positive COVID-19 employee and the health department has reached out and we are doing the contact tracing at this point. So again, upon a positive COVID-19 patient confirmation, the employer will work with the health department to identify those other employees that may have had an exposure by definition. That will be determined by the health department. For those identified exposed community and coworkers, the health department will recommend quarantine, and occupational employee health will track your coworkers' information. That's where our free tracking service comes in. And we have set up an email and have made it fairly easy for communication on those employees to report their symptoms, which consist of their temperature and their symptoms or lack of symptoms during this exposure period. So we have developed an employer COVID track line email, which is the employer COVID tracking at genesishcs.org. They can send those results through that email. They can call the phone number of 740-450-3350 and leave a voicemail with those symptoms and results, or they can also send a secure text. So we've added 3 ways of communicating and tracking mechanisms for the temperature checks and the assessments. So that's if we are doing a self-monitoring with delegated supervision that is imposed. We'll do the same for self-monitoring without supervision. If without supervision is imposed, occupational health will track begin and end dates for the employer. So what will we send to employers weekly if they're in our program? So what we will send to you is a spreadsheet and an information sheet noting your employees' names, the dates of birth, the level of protection that has been provided, which is self-monitoring with or without delegated supervision or quarantine, and the beginning and end dates of their quarantine period and a return to work date. So those are the items that we will send the employers, so there is no question as to when their employees can return to work or when that quarantine period is over. That way it helps with future planning and staffing and productivity levels. So slide 16 is, we just want you to know, and hopefully you understand that we are here for you. We want to be your partner in this process. We care about our community, we care about our patients, we care about our employers in this area. And this is a free program that we want to offer you, and we want you to join this program moving forward. But I have also provided here the contact information for this program. So the hours of operations, Monday through Friday, 8 a.m. to 4:30 p.m. That's when we have the registered nurse that is dedicated to this program, and also that is in alignment with our COVID clinic telemedicine line. Our location is 2800 Maple Avenue, right beside, we're located in the HealthPlex. And the main number for the Genesis Occupational Employee Health is 740-454-4010. So one thing that I would add or note that is after hours assistance, please contact the Genesis Employer COVID tracking line at those 3 different ways that I provided on the slideshow. That's 740-450-3350. And you can leave the following information, which is name, employer name, symptoms, date of birth, start of symptoms, and phone number. That way we can get back to you as soon as we can to track your employees and gather the information for you. Please note that if this is a true emergency, please direct your folks to the appropriate site of care, which could be first care, it could be the emergency room. But with COVID-like symptoms, usually if it's quarantine, it's wait out the symptoms, they can wait till the next morning. Again, it's emergencies, or if they truly need immediate care, please don't hesitate to send them to one of our Genesis facilities. But if they can wait, that's where we come into play, and we will follow up with them. The Northside Pharmacy's thermometer program would put that contact information in there as well. So if you have any needs for thermometers, please contact Carrie or Kyle at 740-454-8331, and we will get you folks set up with these thermometers and make sure that you have the resources for that to start your assessments at your locations. So the next question is, are you ready to join our partnership? So again, we are excited about this program. We want you as a partner. We want to work with you. We want to make sure that you are successful, because we feel that what we have done here at Genesis, we can share with you all and hopefully make your business successful, and with this COVID pandemic present at this time. So you can contact me at 740-454-4057. And what will happen is, if you express your interest and you want to join our program for these free services, again, the free clinic visit, the tracking, and the free return to work assessments, you can contact me, and my team will establish a start date. We will enter into a service agreement, and we will define your leaders who will be in contact with us. And we will also provide program support materials such as flyers if you need it, policies that you can develop. We have developed a policy, but we are currently looking at an HR-based policy that you can either adopt or you can create your own using that particular policy as a guideline. And we will also provide you a process map to hang up, so you can have that at your fingertips if this situation presents itself in your workplace. And again, we want to be your partner for all your questions, needs, and concerns. So that brings us to our partnership with the health department. And as we know, for the last 7 weeks, this is a very fluid situation. I believe without our health department's guidance in keeping us informed with the changes, and also helping us with some of our guidelines that we have here and our policies, we believe that they are an important piece of this program. So, with that, we will effectively communicate the current state of the situation and upcoming changes with you to ensure that we are all working towards a common goal. And again, that's in partnership with our health department. But this brings me to
I just got one real quick thing to kind of summarize before we turn it over to Dr. Butterfield. This bad period yet. As you can see, it's a very involved process to be able to manage employees through symptom assessment, evaluation, treatment, etc. And we have been doing this for the past 7 weeks or so, as we've described. What we have done is we have scaled up our capacity in occupational health, because we realized we can scale this program to serve the entire community. So we've added additional resources, and with the goal of making this complex process as simple for you as possible. It's going to provide you with HR policies, with this process, and as you can see from what Josh just went over, it's you have a handful of things for you to do, but then if you have any questions about any employee, then we kind of take it from there. And so our goal was to make it free, make it easy, and make it very highly effective for you. At this point, we would love to turn this over to our colleagues at the health department. Dr. Butterfield.
Thank you. First thing I would say is we are fortunate to have such a partnership in this community, not just with Genesis, but from the very beginning of this COVID-19 crisis, this pandemic, we have had what's called the Muskingum County Unified Command, which is made up of, many of you probably know this, made up of the Health Department, Genesis, the Emergency Management Agency, EMS Services, law enforcement, which includes the ZPD and the Sheriff's Office, city government with the mayor, the county commissioners, senior citizens. I'm sure I'm missing some, but it's a wide-ranging, probably 30-some members on Unified Command that has been meeting almost daily, actually daily for the first 4 weeks, and then Monday, Wednesday, and Friday since then. And in the last few weeks, it's all been virtual. But nevertheless, we've been meeting to try and mitigate this disease in our community. And so far, our numbers have been very good. And that's very reassuring. And that indicates that we have a community that cares and can safely work together, which cannot be said about a lot of other counties that we are aware of simply because of what we're doing. So it's good to be living in Muskingum County at this time. The other thing I'll say is we're living in an unprecedented time. This is completely uncharted waters for us, and no one has ever experienced these times before. So we are trying to navigate these waters as calmly as we can. I do want to emphasize that this disease does have community spread, which means it is spread from person to person, and it has been, we have shown that to be the case in our community. Even though we have a fairly small number of cases, most of them have been person to person. I also want to emphasize there is some sense that this is just like another flu. And you will see YouTubes and different articles where people are using statistics to say, well, the death rate is this, the death rate is that, it's lower than influenza, it's the same as influenza. And what I want to say to you is statistics can say, you can manipulate statistics to say what you want them to say. What I'll give you is two facts. These are not statistics. Influenza from October 1st to March 31st in the United States killed 40,000 Americans. COVID-19 in 2 months, from February 28th to today, has killed 60,000 Americans. So those are facts, those aren't statistics. And I'm telling you that to emphasize how important it is that we be safe in our community and protect each other. The first slide that you see there is about masks in a workplace. Health Director Dr. Amy Acton signed yesterday a Stay Safe Ohio order that is a follow-up to the stay-at-home order that was signed a month ago. And that order went into effect today at 12:01 a.m. Part of that, and it's about a 13-page or 14-page order, and there is a link on this that you can get to that. But part of it is about masks in the workplace. Understand the first bullet point that was under the 5 protocols for businesses getting back to work was no mask, no work, no service, no exception. That applies to employers and employees. Face coverings are required while on the job. There are some exceptions, and I'm listing those on this slide. And those exceptions are an employee, I don't have to read it to you, but if it's prohibited by law or regulation because of the job you're doing, if it is against documented industry best practices, if it is not advisable for the health purposes of that particular worker, if it's a violation of the company's safety policy. This is the next one is a big one. If the employee is sitting alone in an enclosed workspace, if they're at their desk, they're socially distanced, they're going to stay at their desk, no one's going to bother them, no one's going to come and ask them anything. They don't have to wear it at their desk. If there's a practical reason for them not wearing it, let's say that you work in a scrapyard and it's 90 degrees out and humid, and this is going to be wet with sweat in about 3 minutes, and then it's no use, it's not able to breathe through it. That's a practical reason to not be wearing a face covering. And if any of these exceptions apply to a business, then if someone says, well, XYZ business doesn't have their masks on, you may be asked to provide justification for that in writing. Next slide, please. Reopening guidance for cleaning and disinfecting public spaces, workplaces, businesses, schools, and homes. The website there at the top is where you can find that guidance. And Then also, I put the Zanesville Chamber of Commerce and the Zanesville Muskingum County Port Authority websites. Both those websites are robust with advice for the businesses that are reopening. And also, I should just mention, remember, not all businesses can reopen on Monday. There are specific guidelines for who can and who cannot. Next slide. Now, some of the guidance that you will find is very high altitude, kind of overlooking the whole thing. This is one of those high altitude slides where you develop your plan for cleaning the workspace, you implement the plan, and then you maintain and revise it. This is kind of as I say, a high altitude picture. Determine what you need to do, how many areas need to be disinfected, what resources are you going to need, and then you're going to implement it by cleaning the dirty surfaces and using the appropriate disinfectants. There are EPA approved disinfectants that can be found at the CDC website. And always follow the directions, of course, for safety reasons. And then you want to maintain your plan. Next slide. Now, this slide is just the beginning of about 3 or 4 pages that talks about how to clean and how to disinfect, and what about soft surfaces, what about electronics and laundry, and what about cleaning if one of the employees actually became sick on the site, what about cleaning and disinfecting outdoor areas, and when cleaning, who can do that, what do you do with the cleaning supplies after you've used them, do you need to wear gloves, and when do you need to wear gloves for cleaning, and then additional considerations for employers. So it's very extensive on this website. That I thought I had listed at the bottom of that slide, but I guess I didn't. But if you go to the cdc.gov, you just type in cleaning and disinfecting your facility, boom, you'll get this. Next slide. I guess that's the last slide. So what I want to emphasize is you have a community of concerned people in the United Command that are our whole goal at this point is to get our economy back on track, but to do so in a safe manner. The stay-at-home orders are still in place that were there a month ago, as far as only leaving if you have to. Now we will be having some of these industries reopen on Monday, and that's travel that you have to do to go to work. But safety is still paramount, because what we don't want to have is recklessness that results in community spread of this disease. It results in a secondary surge, because this is a deadly disease, and we don't want, the last thing we want to see is a reclosure of industries that have started to open. So we need to be sensible. We need to be sensitive to the needs of our industry, and get them open as fast as we can, but doing so within guidelines that are safe for you as employers, for your employees, and for the consumer that is using your services. So, and that kind of ends what I have, and I will be on the line for any questions. And also, the Health Commissioner, Corey Hamilton, is on the line for any questions that might be directed her way as well.
All right, so we will open it up for a few questions and answers. If you are calling in from a phone line, you will need to unmute yourself, which means that you will have to dial the *6, and that will unmute you for questions and answers. If you are joining us through the Teams portal, you may unmute yourself there and ask your questions through that process as well. So at this time, we will open it up.
I will mention one other thing. In the slides, 2 things actually. The slides, especially toward the end, when Josh went through the process, those are very, very busy slides, and it looks like it's very complicated. The unique thing about this process is Your part is not complicated. Once is made, occupational health and the health department kind of take over that for you. And the communication is both ways, and it's transparent and it's open. So don't get overwhelmed by the busyness of those slides. That busyness will be taken care of for you. The second thing, in all those slides, it said that the occupational health will coordinate with the local health department. It did not say Zanesville Muskingum County Health Department, and there's one reason for that. Some of your employees don't live in Muskingum County. So occupational health will communicate with the county health department of residence of your employee. So if it's Perry County or it's Morgan County, they will be communicating with those health departments in the same fashion as they will be with us. Obviously, the lion's share will be with us, but those other health departments are who they'll be using. That's why it said local health department.
Thank you, Dr. Butterfield, very much for that clarification. Are there any other any questions that anybody would like to ask?
To clarify, if you do have a question, you'll need to make sure that your phone device is not muted, and you will also need to dial the *6 to unmute the.
Sorry, I joined late to this conference call. How can I access this slideshow if I'm dialed in on a phone and want to access this after the meeting?
Yeah. So this this PowerPoint slideshow was emailed to the chamber members from Dana. If you cannot find that, I would encourage you. You can reach out to me. This is Josh Jones at Occupational Employee Health, and I will make sure that you get a copy. And you can.
Okay, thank you.
Yes, my phone number is 740-454-4091, and I'll make sure that you get a copy.
Okay, thank you.
So I have a question. Can you guys hear me okay?
Yeah.
Yes.
Josh, this is Corey. So I guess my question is in terms of associates that have health concerns. So if we have an employee that has COPD or some sort of health concerns, and they believe that wearing a face covering would obviously hinder them in a facility that doesn't have air conditioning or anything like that, and they acquire a doctor's note saying that they don't have to wear a face covering, would that employee still be able to work?
So Dr. Butterfield, can you help us out with that question?
Yes, I'll answer that for you. The exceptions do include a stipulation if it is if it places the patient at risk because of personal health conditions. They do not have to wear the mask. I think each one of those are going to need to be considered individually on a case-by-case basis because the overwhelming majority of people don't have medical conditions that would warrant not wearing a mask. And the other thing to remember about the mask is a barrier for spreading this virus. This virus is spread by respiratory droplets through talking, coughing, sneezing. And if you are wearing a mask, you are protecting the other people around you more so than yourself. There is a bit of a barrier to protect yourself, but the reason you're wearing it is because you may be an asymptomatic carrier who doesn't have symptoms yet, but yet you could be spreading this virus. So wearing the mask is the socially responsible thing to do for all the coworkers. And in the great majority of cases, people are going to need to wear the mask. There are health conditions where it would be necessary or essential that they not wear the mask. Significant COPD is one of those sorts of things. But I can envision lots of reasons people may think that they don't need to wear it, but the reasons are actually going to be quite few.
Yeah, so there's a lot of distribution centers and industries around this area in particular that are quite hot on the inside, and obviously wearing the mask makes you touch your face more often, and and we can get into all of those specifics. But I guess in terms of like HVAC and air conditioning, so for example, I have associates that are concerned about how hot it is, and wearing the mask. Would it be acceptable for a facility to increase the airflow in their facility to make the associates more comfortable, or would that cause more of a hindrance if there was a coronavirus exposure or potential?
Well, I think that environmentally makes sense, and I'd urge you to do that, because the virus doesn't just kind of hang out in the air like a cloud. It is spread through respiratory droplets, and the majority of those droplets fall and hit a surface. Now, in most workplaces, that's probably going to be the floor, but it can land on a desk and so forth. But just increasing the ventilation is going to, any of those respiratory droplets helps to get those carried away, but it just keeps the place a little bit cooler. Obviously, if it's so hot that they're sweating and their mask gets wet, then they can't breathe through it. So that's a situation where, for instance, you probably would not be required to wear a mask. Anything you can do with the HVAC to make it more comfortable so that sweating is less of an issue, I'd be all for that.
Yeah, I know one particular situation that industries in this area are looking at are, people loading trailers, for distribution, or, something along that nature where, the heat is very hot. I mean, we're talking 90 plus, 20 degrees hotter inside the trailer than what it is in the outside in the environment. So that would be a situation that may fall under the practical reasons for not having to wear a mask.
Yeah, I agree with you entirely. The thing that goes along with wearing a mask is to remember the social distancing. Whenever possible, even inside that trailer, if it's possible, keep 6 feet or more away from your coworker. But in that situation, a mask is not going to be feasible.
Yeah. Now the documentation
common sense needs to prevail.
Yeah. No, I guess I'm a little stuck on the business must provide justification upon request. So I guess what kind of justification in that instance would the health department look for?
Well, let me just give you an example. We have a call line at the health department, and on a daily basis, we're getting a dozen or more calls from people saying, I was in XYZ business and they weren't wearing masks.
Yeah.
And in some cases, it's good, if it's a loading dock and they're in trailers, the answer to that is obvious. And probably nobody's going to ask you that. On the other hand, if it happens to be, say, a retail store of some sort, then the health department will issue a letter asking for justification why this particular employee or set of employees were not wearing a mask, because by virtue of the health director's order, it is law that employees have to wear a mask with the exceptions as they were listed. So the health department may request in writing justification for the employees not wearing a mask. Again, the health department is going to use common sense as well. So, if you're in a trailer, or you're, like I said earlier, in a scrapyard and it's hot and you're sweating like mad and your shirt's soaking wet, obviously those things are not situations where a mask is appropriate. So I don't think you need to take that as punitive. That is there basically for I think for businesses that are going to be reckless in following the guidelines.
Okay, thank you.
Good question.
Would a plastic face shield replace a cloth mask in effectiveness?
No, it doesn't. It provides somewhat of a barrier, but the droplets are light enough they can get around that. The plastic face shield primarily is for splashes. And so even, for instance, in dental offices, it's recommended to wear a face shield and a mask. So the face shield's a good idea, but it doesn't replace the mask.
Okay, thanks.
We have about 3 minutes left. If there are any more questions, please let us know, and we'll be more than happy to answer those questions for you.
Well, we really appreciate your time today. If you're interested, if you're interested, we just call Josh at that number, and we will get you connected, get you signed up. It's not that difficult a process to get signed up with. And also, if you know of anybody who might not have been on this phone, this conference call that you think might be interested as well, please spread the news. We're going to be publicizing this very widely. The more we get people signed up for it, the better job we're going to do as a community and being able to control this going forward.
This will be posted on website.
And this is going to be posted on which websites?
It's going to be posted on the Genesis website, the recording of this Genesis website. The Department of Health has agreed to post it there, and Dana has agreed to post it on the Chamber website as well.
So it'll be on all 3 websites.
I think also you ought to send it to Matt Abbott to put on the Port Authority website.
We'll do that too. Well, thank you all so much for your time today. We're looking forward to working with you. Thank you so much.